Gestational diabetes can lead to higher birth weights and the need for a C-section, both things the mom we talked with yesterday experienced.
I did have gestational diabetes with her, and they wanted me, my OB's office were encouraging me to have a C-section at like 37 weeks.
Oh.
But she was perfectly healthy. And I didn't see a need to have an elective surgery that I didn't want to begin with, just because she was going to be a large baby.
Baby Maya had other plans and her hand was above her head during labor, so Dorisha Rodriguez ended up having a C-section last month. It's something that's common with women diagnosed with gestational diabetes.
Large for gestational age or babies who are greater than 4,000 grams is more likely. In moms who have gestational diabetes, there's increased risks of pregnancy complications like preeclampsia or developing high blood pressure in pregnancy. There's an increased risk of a complication called a shoulder dystocia, which is where the baby gets stuck coming out because their shoulders are too big for the birth canal.
Dr. Heather Link, medical director of ultrasound quality at Kaleida Health, says gestational diabetes happens because of impaired glucose metabolism or increased insulin resistance that happens because hormones released by the placenta make it harder for your body to process sugar.
A big placenta that's growing and supporting a pregnancy is going to make big hormones, and that's okay. As long as we know about it, we can treat it, and we have excellent, safe medications to do that. There are risk factors that patients have that they can't change. You can't change your age, you can't change your family history, and, when I'm talking to patients about that, I just say, please, when your doctor asks you to do your sugar test, do your sugar test, And then if they tell you you need to do a little bit more, we'll meet people where they are, but healthy moms, healthy babies is everybody's goal.
And both mom and baby Maya are healthy. Doctors usually test for gestational diabetes anywhere between 24 and 28 weeks into your pregnancy. On your side, Kelly Dudzik, Channel 2 News.